Let's go ahead and do the shark first, see where we're at. So let's begin on the side here, which is where we see some basic features, right? Here we can see our horizontal, oh, this is kind of ugly. Here we go. Horizontal squalagena septum. This is really not very good. And of course, we have above it the epaxils, below it the hypaxils. And you can see at the right angle, there's some little white lines there. So here are myosepta, and then of course the myomeres, right? Basic stuff. And of course, phrasing would tell you that. What's the name for this muscle segment? What's the name for this connective tissue partition? Right? What's the name for this connective tissue partition? What's the name for this group of muscles versus this group of muscles? Right? So you know when I'm looking for epaxils or myomeres or what. Here's a very easy muscle to identify. It's on the dorsal aspect of the pectoral fin. That's the pectoral levator. You wish I'd ask action on that. That's a pretty straightforward one. Here as we are behind the head, we can see two muscles. We have our levator plato-pterygoquadrate, originating on the oticapsule, inserting on the plato-pterygoquadrate. Action is to raise the plato-pterygoquadrate or raise upper jaw. And here we have our sporacularis, which alters the size of the spiracle. There's our mandibular adductor, definitely one I'd be aware of for homologies, since it's homologous to three mammalian muscles, right? Temporalis, masseter, and pterygoideus. Here we can see the second dorsal constrictor, third through sixth dorsal constrictor. And if I ask you specific or what number, just count. And then we have this muscle here, which again, I guess I should have grabbed a different one because it's kind of a little wrinkly. Sorry about that. This is how you separate out the muscles. There's our cucullaris. All I'm doing is pushing at it with the tip of the probe. That's it. It's all you need to do to get those borders showing better. There's not a lot to it. So here we can see the scapula, and there's our third through sixth dorsal levators, also called the cucullaris. And again, another one you should know homology for. All right, ventral aspect. Again, here's our hypaxial muscles, myosepta, myomeres, linea alba. Here's the coracoid bar. Here we can see the muscle on the underside or ventral aspect of the pectoral fin is the pectoral depressor. Here are common coracoarcurals. This muscle here with a really well-pronounced fiber pattern is the intermandibularis. It's part of the first ventral constrictor. Here you have the second and then third through sixth ventral constrictors. One thing to be aware of here, we look at our intermandibularis. We have a seam down the middle, that's called the median raphe. All right? And of course, what muscle is this homologous to in your raphe? Digastric and mylohyoid. Very good. So that's it. Not a lot of muscles there, but you should be aware of them. Do you want to keep on